We have a 19-year-old male this time that has received a bat swing in his face while playing in the local baseball championship. In the emergency department, the patient complains about orbital pain. Also, he states that everything is double. When asked to fixate the doctor's finger, his downward gaze is impaired. What is the best next step and the most probable diagnosis? CT scan of the head with retroorbital hematoma, CT scan of the head and blowout fracture, MRI scan of the head and blowout fracture, or CT scan with orbital compartment syndrome. Indeed, it is a blowout fracture. The CT scan of the head is to watch for any herniation or muscle entrapment, namely because the inferior orbital floor can be damaged and nerves as well as the muscles can be entrapped in the area of the maxillary sinus. Now let's discuss the answer. How would we proceed in analyzing this vignette? Both retroorbital hematoma and orbital compartment syndrome are complications that can be seen in a blowout fracture. A retroorbital hematoma may be responsible for the patient's diplopia since he sees everything double. We have no sign of orbital compartment syndrome, which usually presents with a rock-hard eyelid. On the other hand, the differential between B and C as an answer is made by the convenience as well as the rapid implementation of the imaging technique. An MRI scan will take more time and it is more costly than a CT scan. A blowout fracture is a fracture of the orbit. It usually presents with extraocular muscle and nerve entrapment, especially the inferior rectus muscle, as in this case when the patient cannot look down. The muscle entrapment also is responsible for an oculocardiac reflex activation. Activating this reflex will lead to severe vagal symptoms such as bradycardia. As I've told before, an orbital compartment syndrome is usually presenting with rock-hard eyelids. How do we treat the blowout fracture? The blowout fracture is treated with surgical drainage of the retroorbital hematoma that might cause the orbital compartment syndrome. If we have entrapped muscles, this is an emergency. Surgical decompression is required in this case. And if the patient is severely bradycardic due to the oculocardiac reflex activation, then we administered atropine.